Mr. Clem, Dr. Clem, how are you doing today? Things going all right?
It's been a good day. We had Mark just a few moments ago, and it brought up some old feelings of mine. And that was a good time in my career. I was halfway through my career. Well, I'm 37 years into this, and I was just still young. And it was invigorating for me to talk to him again.
Yeah,
Major influencer in your life, moments of clarity. And, Paul Homling was another one, a moment of clarity for me in my life. And I really appreciate those people coming on. And it's all good. It's good to talk to you as well, Todd.
You're
I
probably
feel
getting
like I'm
tired
with
of
you.
me. You're probably getting tired of me, as many as these we've been doing.
Well, the good thing about this is that when you get tired, you just turn off the camera.
You did that on Mark. I think you got tired of him for a second.
Well, I was dealing with some technical issue here because both of us were actually projecting this from our high-end cinema cameras, and it's a lot of fun to do that. But then I saw something happen. So
That's okay.
What I learned from that is you always need to have a backup plan, and I look forward to talking to our guest today about her backup plans, particularly with your practice and how we're going to deal with what we're going through right now.
Yeah, there's a lot of confusion in this world right now, and that was the reason why we came on, because starting to do this, because we know there's a lot of leaders out there that are doing things for their team, their family, their friends, and we want them on to share with it. And before we bring Kristine on, I got to tell you, James, I am really, really excited about this weekend because this is the time of the Milky Way season for me. And tonight, the moon is going to be it's going to be gone. And I'm going to be riding my motorcycle out in Central Texas. There's a picture of me in front of the Milky Way. And so I'm going to try to capture this tonight. So I'm not going to bed tonight. This is my journey tonight. So
Todd, I have enjoyed your journey of photography. One thing I've noticed about Todd, I'm gonna talk about you for just a moment. So just
Please.
listen. And I've known Todd for quite a few years, and what I've learned about Todd, whenever he gets an interest, he masters that interest. And this is definitely one of the things you master. In fact, I'd love to do one of these Facebook Lives just on your photography. It's just mind-boggling. In fact, I would like to get some of those prints. Of course, I'm aging myself, and put them on my wall.
No, I do sell quite a bit of stuff. I'm not here to market that, but I've got some other ideas. Mark Morin was telling us that he sells what is that medicine that he sells?
It's a pharmaceutical sedative process.
Yeah. Well, I can't do that in Texas, so I got to do other things. But anyway, I'm going to do a Facebook Live actually on how to process Milky Way pictures. It's pretty fun actually. It's a lot of fun. Now we have a new segment in our little show here called Thoughts with James, and you are definitely the philosopher in dentistry, and I love hearing all the things that you've got to say, and you've always had a word of inspiration. So what do you got for us today, buddy?
Well, it deals a little bit with our guest. I'm really looking forward to talking with Dr. Kristine Aadland. And I've been watching her on Facebook. First of all, she's an incredible clinician and a really good educator. I mean, her anterior work is second to none. And I'm watching her do that. And on top of that, I got to find out what her energy factor is, because she has grown a practice, and you'll see what I mean in just a moment. But this is my thought for the day, and it's a segue into talking with Kristine. Commitment is that turning point in your life when you seize the moment. You got to seize the moment and convert it into a opportunity for destiny. And I think we're going to hear that story in Kristine's life. So let's bring her on.
There she is.
There she is, and I was looking forward. You're part of the Epic Woman's Group, right, in CAD/CAM?
Yes.
And I want to let you know I am a fan. I follow you folks. I've been watching your career. I've been watching your dentistry. Can I say this? I'm really proud of you.
Oh, thank you. That means so much more than you know, especially coming from you.
And you know what? You were sharing with us before we started broadcasting today your story, and I think it would be very encouraging for our audience because you started a practice in what year?
In 2009, startup.
Oh my
And
goodness.
that's right after 2008, and look at you now. Why don't you walk us through that process? Because right now I'm looking at you, and I know that you have this sense, you have this intellectual power, and you're this clinician that has good critical thinking, but you're a risk taker too, aren't you?
I am a risk taker. Yeah.
So why don't you share with us your story and how you started this amazing more than one practice and you wrapped it around technology?
Yeah, thank you. So I graduated in 2006, and I had an opportunity for an associateship at a town about 20 minutes north of where I live, and it was
Hmm.
another startup. And I was just so excited to be able to witness this startup because I knew ever since I was graduating, I was going to be my own business owner. There was just
Hmm.
no question about it. And so I watched him, and he had this CEREC machine. And we didn't have it in school when I was in school. And it was very taboo. You were definitely a cowboy if you used a CEREC, and obviously a bad
Yeah,
dentist. And, you hear
that's
all those
right.
things. Oh, and so I went in really nervous, but I just witnessed the power that it had with patients and how much they loved the single appointment dentistry. And then more so for me personally, as a young woman coming in, I would always get the, oh, are you old enough to be a doctor? But they watched me use this machine, and then I had instant authority. And they thought, oh man, she must be so
Hmm.
good because she can
Wow.
maneuver this computer.
Good point.
And yeah, it was great. And, did I see things fail? Absolutely. I didn't have a respect for materials or prep design or all those things. And that's where education really became so important.
Hmm.
When you first graduate, I thought I knew everything. And I wish I knew as much now as I did, or certain I did then. But it was a great journey. So here 2009 came, and the world seemed like it was ending then, much kind of like now. And
Yeah. Yeah.
it was the time for me to go out on my own and do this startup, and I really wanted to do it. And for me at that time, my advantage was I was single and on my own, and if I was going to starve, then I could eat mac and cheese and that would be fine. But my background is actually construction, so my fail safe
Mm.
was I was going to go run heavy equipment and probably make more than doing dentistry
Oh,
if
really?
something was going to go wrong. Yeah.
Wow.
So I grew up, my parents were bridge builders and grew up running heavy equipment and worked for a subcontractor for
Wow.
9 years. And so I always knew I could fall back on my Carhartts and my cat key
Wow.
to run that. But
Hmm.
I looked around, and I'm in a pretty competitive market. I had 80 dentists around me, and no
Hmm.
one really did CAD CAM. And I thought, okay, I need to stand out. How can I do that? It was also the time when WDS cut their fees by 25%. So everyone was dropping PPOs. And my competitive advantage was my last name is Aadland. It starts with two A's. And so I'd be first on every list. And I knew I could utilize that
Yeah.
technology, even though it was
Hey, that's not
expensive.
fair.
I know. Definitely not fair.
It's time to
As
change our
always.
name. Time to change our name. Yeah.
um, I knew I could use those efficiencies and gain back that ROI. And so I had penciled it out. And honestly, I think not having a dental background helped me. I grew up in a family business. They were very open about
Wow.
business, but I didn't know what you were supposed to do. So I read a lot of business books. I did a lot of classes in business when I was in college, and I just kind of took that and ran with it. And so I built a building, 13,000 square feet, and I have an orthodontist in there and a periodontist in there. And then I had this empty space. So then a year in, I decided, I'm really into fitness and nutrition. So I opened a fitness studio with a little cafe and a spa. And a
God, I don't
couple
even
years
know.
into
I don't
that,
even know what I'm going to eat for lunch today. And you're more organized than I'll ever be.
I love the puzzle of business as much as I love
Yeah.
dentistry and fell in love with dentistry. And so grew my
Wow.
practice from 3 ops to 9 ops. And now we run pretty hard. I have a full-time associate with me. So 5 days a week, we have two doctors in the practice at all times. We run 4 or 5 hygiene. And then I bought a second practice about a year and a half ago. and have a full-time associate there. And we're watching that grow, and CAD/CAM's a huge part of that as well. And so it's fun to just put those pieces in place. And I think I loved your quote at the beginning, James, when you talked about it, because I think resiliency is going to be the key of how we're going to be successful getting out of what's happening today. And we have that advantage with all the technology we have. I mean, as you can see, even doing these Facebook Lives and all those webinars and Zooms. And I think if you're willing to be resilient, and a lot of us are in the technology world, then we can still be very successful.
You know, just the few things you've said gives me a whole new perspective of your success. So let's back up for a moment. You grew up in a culture of business with your home life as a child, correct?
Correct.
And
yes.
so you know, that's really interesting to me, because you naturally think in that's kind of like, is there any other option but to think in that positive way? And I can already hear that coming out of you. So how have you been communicating with your team during this time?
So most of my team communication's been just through chats on like text threads. And I'm still going in and seeing emergencies. So I have a few of my team members coming in through there, and just trying to keep everyone really positive. You'll be able to tell I take myself super seriously. So we're trying to come up with some fun ideas as to how we're going to show our patients the new PPE protocols coming in. And so we're coming up with some fun songs. I like to do spoof videos. And so we're going to do some like TikTok things and Instagram commercials. And so we've been working on some side projects like that, and just trying to keep everyone going and positive.
Great. So how many STEM team members do you have within your practices?
25.
Wow. So do you feel like you're a natural leader, aren't you?
I maybe.
Yes, you are. Don't say anything else. You are definitely a leader.
I definitely am. I'm not afraid to take control. I like forging that path. I definitely believe in leading by example. And I'll tell you, with the second practice, that's probably the hardest thing, is not being in there every day. And because I love being just a part of teams. I've always been a team player. So.
No.
Well, let's go back to.
Oh, I'm sorry.
Go ahead.
Go, James.
No, Todd. I've been operating here. I want to hear what you have to say.
We are too polite. We are very polite guys, and we don't like to talk over each other. So with that many team members that you have in 2 different locations, how are you communicating with them? How are you managing their maybe emotions for this time, and maybe uplifting them to come back strong?
So I'm very fortunate that my associate at my second practice is an incredibly strong leader, and she was a hygienist prior to being a dentist, and she's been in dentistry for a while. But I'm just watching her take her wings and grow. So she's been a huge part of her team, which has been great, and that's what I want. I want her in that leadership position there. So just her talking to her team, we're on a constant text thread, and it's sending funny quotes. It's just kind of doing check-ins. It's we're trying to figure out when we're going to come back. It's like a day-to-day thing right now. So when we're going to physically have everyone comfortable being on location to start doing some training, I'm really hoping a week before we open that we'll be in just doing all the little things that we didn't have time for. And why not get it done now? So brushing up with our back office, front office, all those things that kind of drive you nuts, that you think, okay, we're going to get to that next team meeting, and then the next team meeting happens and you forget or whatever. So
I think I'm going to have to prep some teeth on a dentiform just to get the handpiece skills back.
I miss that for sure.
I want to step back for a moment, because you mentioned that you built your practice around technology, and that's a discussion we've had with other people, particularly now. You started with a 3D and you have CAD/CAM, and a lot of our audience is around technology. So how are you going to encourage them to maybe go to the next step? Maybe they don't have the Prime Scan yet, or maybe the Prime Mill. What would be your advice?
So for me, everything has been about efficiency. So I'm in a smaller town outside of Portland, Oregon, and my personal mission. So the average family income in my area is 50,000. So it's not super high for a family income. PPOs, all my major employers are on PPO plans. And so for me personally, I want to learn to give the best dentistry I possibly can in a PPO environment. And that is very strategic. And to do that, and still make money. To do that, you have to be incredibly efficient. And that's where technology comes in. So, when the Prime Scan comes out, it's exciting and it's new technology, but you do have to take that ROI into consideration. And for me, it's all about time and chair time and how can I maneuver that versus assistant time and what's that profitability coming back. And I will say Dentsply Sirona has been amazing in making things more efficient. The new software, Prime Scan, I had to scan with the OmniCam the other day for an Invisalign case, and I forgot how much I did not enjoy that. I love the lighter camera, but Prime Scan just scans so much faster. It's knocked off a good 15
it's
minutes.
Unbelievable.
And then you add go ahead.
Go,
no, you know what? I had to back up, and I still use my OmniCam for anterior implant scans because I like the 452 software. But habits develop quickly because I'm sitting there wanting to hit the screen with my finger, and I had to remember I'm not on the Prime Scan, so I'm glad my patient wasn't watching me because I was doing this. Go ahead,
Kristine. This doesn't need to be an infomercial at all, but it is a topic that's kind of come up because this is uncharted times right now, and there's a lot of companies that are looking to sell things. Like take car dealerships right now; they are offering deals that just cannot be beat. It's almost silly not to go buy a Ford now. Do you think it would be an appropriate time for some, not all, of course, some dentists to maybe jump across that line and get into the technology?
I'm a huge believer in technology, and you do have to look at your personal situation and really pencil it out. But the thing that I'm looking at this point is so right now I have 4 or 5 hygiene. I'm bouncing around in all these rooms. I'd work 2, sometimes 3 columns. Am I going to be able to do that with the new PPE protocols that are in place? And so if I have to go back to single chair dentistry, then I have to be even more efficient within that one appointment.
Yes,
so for me, the Prime Mill, if I can mill a crown in 4.5 minutes, or less, that's incredible. And when is that time savings going to come about? Especially when I have multiple providers in there. So is it a possibility? Absolutely. I think it is. And I think, it's important to pencil that out and see what's going to happen, but I'm a believer in it.
How do you think your patient flow is going to go with that big practice of yours? Like a patient is out in the parking lot, or because I don't know how we're going to do it yet.
Yeah, that's the big question. So I have a pretty big office, and I kind of have a flow where I had a entry and an exit, but now I almost have 2 waiting rooms. And so we're talking about either bringing hygiene in on one side and ops in on the other side, definitely spreading the chairs out. And then I think we are going to wait for patients or have them wait in their car, text them when they're allowed to come in as soon as the room's turned over. I've always ran really lean. We have Isolite in every op in my main practice, and we have Dry Shield in the other practice. And so I didn't need that many assistants because it really does help. But now, bringing in a sterile tech to really help clean efficiently, flip those rooms, I think things like that are going to be even more important. So yeah, we're going to definitely change the flow, and it's a conversation we're having with the team and see what makes sense.
Do you think
that's amazing?
Yeah. Do you think that you're going to be in a fast pace right off the bat, or do you think it's going to take some time? What do you think the patient flow is going to look like in your area? And by the way, where are you? I'm forgetting where your location is.
So I am in Vancouver, Washington, which is just on the border of Washington and Oregon. So I'm literally 20 minutes from Portland, Oregon.
Got it.
And so I'm that big nerd. I went through, I missed 675 hours of hygiene. So we have this huge backlog of patients being closed that we are trying to get in. And do I think everyone's going to come in? No, but I think there's enough of that backlog. Like I made Excel spreadsheets for who's the new patient, who's the SRP, and anyone who doesn't want to come in, we can fill that really efficiently. And there's definitely things you can do on software too, but a lot of times it's kind of cumbersome of where you find those reports. And so we wanted really easy lists of how we can fill those appointments. I think it's going to be incredibly important to check benefits for every single patient. And so that's where my front office is going to be huge because people are losing insurance. And then just making sure, the compromised population is feeling comfortable too. And, we're waiving the fees. If you're not comfortable, we're not going to bring you in. But we're definitely going to promote all of the things that we're doing. Like we're bringing in the HEPA 13 air filters, and then we'll have face shields and face masks, all that stuff.
James, she's the first one to, she's the first one to say something about checking benefits before they come back in, because, some of these people that are going to unemployment, that's a good question. Are their benefits going to continue while they're in unemployment? Who knows?
And patients don't know. And we have a lot of local unions, and the unions, when they're laid off, they definitely don't qualify. And so it's a big deal because patients don't want to be charged after, especially if they've been laid off.
Yeah. Wow. I'm incredibly impressed with you having this business mind, but you're also an incredible clinician. I know the other night you did a webinar on Cantana, didn't you?
Yeah.
You want to just give us a little overview of your experience with that? Because you're talking about efficiency. From what I'm gathering, you find that to be, outside of an outstanding material, it's also a very efficient material, isn't it?
It is, especially now with the prime mill, because you can mill it so fast. And it's funny. I mean, I started back on RedCam days with a lot of ceramics. And so the idea of zirconia wasn't all that interesting to me. And then especially the Ceric zirconia came out. And I mean, obviously I'm a huge Dentsply Sirona fan, but it was so hard to make it look pretty. And I tried. And then when you did make it look pretty, it took too long. So when Cantana came along, it was a total game changer, because that block is beautiful with that gradation. And honestly, in the posterior, we just polish and go. One of my associates only uses Cantana at this point. Like, she's just so in love with the material, and it's you can be conservative with it. It's forgiving on the margins. It's a great block. So I've been in love actually with their whole system. Even their cement has changed everything with their new SA Universal, because it has the monomers inside. And so it's just extra steps. You can make everything more efficient, less things on your tray. So it's just creating those systems over and over in efficiency, and loving it.
It's cool for all three of us, or anybody in CAD/CAM that's watching, is that we are living technology by the minute. I mean, the Cantana block comes out, and then there's going to be another block that comes out, and it just keeps adding and adding and adding, and we get to live the benefits through all this immediately. What do you think the next big step is going to happen in our digital world? Is it going to be software? Is it going to be materials? What do you think?
Printing just seems to be where everything's at right now. So what are we going to be able to print, and how much in office, and then just make that more affordable for our patients? So I tend to think it's going to be in printing. And especially it's cool to see during this, like, everyone printing masks for, N95 masks for hospitals or for their own offices, or, I don't know, Wally Renee just launched this STL file where it's this suction device that hooks to retractors for hygienists. And so I have friends printing that, and then one that hooks to rubber dam. Like, people are just so innovative, and that's what's cool to see. And they share. And that's the other part of this community, where I just don't think there's a community like it. Like, it's not, hey, you're my competitor, I'm not going to share with you. It's, hey, this is what I did, use it and take off with it. And then if you make it better, tell me how to do it, which is so cool.
Yeah.
It's a good time to be practicing. In our conversation with Don Bell at Ivoclar yesterday, Todd and I were trying to milk him for the future, and he kind of went conceptual, but we know what that means. But my goal would be in the future for efficiency. But in his comment was it's going to be all about printing. And we know that with the intelligence of software, robotics coming in, and having the ability for our software and our camera systems to actually manage optics, color, translucency, of being able to print a restoration that drops in that has the fingerprint of the mouth, that's going to be amazing. And I told Todd afterwards, I just want to stay around long enough so I can enjoy it with my practice, because I think the thing that keeps me alive after 37 years with my interest in dentistry is really the technology. And I love patients too, but the technology is what keeps my excitement going. And, I even have more respect for you now than I did before we started. And that's the reason why is this. You're talking about efficiency, and hearing your story of your practice, I know you have that down. But your anterior work is awesome.
Yeah.
And you're doing that in that efficient. I can't wait to sit in your next lecture.
Oh, well, the only reason I can do what I do is because of providers like you who share work and your tips. And so I just try to take that and run with it. And, so much of it,
Yeah.
honestly, you take photographs and you critique your work and then you have mentors that
Yeah.
help you. I mean, that's how you get better. And as long as you're honest with yourself of like, okay, I could have done this better and how, and you don't necessarily share
Yeah.
that with your patient all the time because
Yeah.
they won't see that. But man, cameras do not lie. They will pick up every problem you have. So
You know who else doesn't lie?
Yeah.
Kristine, you know who else doesn't lie? Are your
who?
epic ladies, because they're like sending you all sorts of love. Mona and Karen and
Yeah.
Sarah.
Right now.
I love them. They are some of my best friends on the planet.
They are awesome people. I haven't really known them very well, but known a few of them for the last few months. And you guys are awesome. You girls, sorry. You girls are awesome. Can you kind of tell everybody how you guys formed and why you're in this club, the Epic Ladies? What's
Yeah.
the
Yeah.
club?
So the funny thing about that is, I mean, I grew up in construction. I was always the only woman on the job site. I didn't have a lot of girlfriends at all because I'll be honest, like
Hmm.
women are really intimidating and scary. And so a year and a half ago, it wasn't very long ago, Dentsply Sirona, a lot of companies are really trying to get more women in leadership because, you can watch the evolution of dentistry and we're 60% women right now, but there's not a lot of leadership roles in that. And so they've
Right.
been trying to encourage that because there's a lot of other things that draw to our attention. And so whatever that may be. So anyways, Dentsply Sirona came up with this epic and they invited us to come out to Charlotte, to North Carolina. And they did some leadership speaking. And then they asked Mona and Sarah and I to speak. And the three of us had never met before. I was incredibly intimidated to meet them because I mean, I knew them from speaking and I was scared. I was scared to go to an event of just women. So anyways, I will tell you, we had the first night, we had this cocktail reception party and like Shivi Gupta came up to me and she was just so happy and cheery and everyone was just so receptive and like wanted to be friends. And we left that couple days I mean, literally we talk every day. These are some of my closest friends on the planet now because we share information. We go through the same things. It's all very, very positive and encouraging. And so we've been really trying to broaden that because there's a lot of women who are like me, who are scared of other women who don't have a lot of girlfriends. And it's not about being exclusive. It's not about like bashing men by any means. Like it is truly about helping each other. And if you want to get on that leadership path, how do you do it? And that's what it's about. It's just encouraging and helping. And
Your comment just then, I've never seen so many hearts come across the screen. There is love in the land with the epic ladies and the epic girls. And I want to let you know, I don't make a lot of comments on Facebook, but I follow you folks and I watch the cases you post and you definitely are raising the bar in our industry. And I am excited to acknowledge that. I'm excited to see it. And I just celebrate your success.
Amen to that.
we appreciate that.
Yeah.
It's intimidating to
And
post.
it
Yeah.
is because in today's world, you got this Twitter attitude in America. My wife's a therapist, and you shouldn't say anything online that you wouldn't say to someone in real life.
Yeah.
And I believe that we need to encourage people, and that's my big pet peeve when I educate. And I really try to find what's going well for people, because as an educator, you'll see it. Everybody comes in at slightly a different level, and my goal at the end of the day as an educator is if my attendees are better than me when they leave in their life, I have done my job. And it's not about, as an educator, it's not about maybe better than others. It's just about raising everyone up together because you want others to have the blessing of our profession. And I can't overemphasize that to other educators in the world because, you got to have a certain amount of fortitude to go out and even educate, because education is being an educator. You got to be willing to take the darts, and that's okay. That comes with life. But my whole goal as an influencer, particularly, maybe it helps to be my age right now, is to build others up and look for what they're doing well. And I think we learn a lot better if we keep a positive attitude about how we go through this educational journey.
Yeah. Hey, Kristine, you just got a shout out from Julie Kellogg. Chris is the best lady in Washington, both in leadership and dentistry, the kind of friend everyone should have. For sure.
Amen to do that. And we celebrate that with you. And This was exciting. You know what? You actually gave. I'm gonna have a better day listening to you and sharing your heart today, and I really appreciate that.
Yeah.
Oh, thank you.
Christine, are we gonna have the Epic Ladies down in Austin? Are you guys gonna?
I sure hope so.
Yeah, I'm not ready for my implant quite yet. We'll see. We'll say maybe try to do it. Dhaval Patel just said hello to you, so that's good.
Oh, I just love this. These are all my big, wonderful, incredible friends.
Yeah.
So thank you.
And James, just going on top of what you just said, as far as the our small niche, I mean, all of us digital dentists, we're in this small niche, and it's growing every day, and it makes us feel like we're not practicing alone. You can instantly get on Keep Sericking or wherever on Facebook, even on Seric Doctor's website or ours, and you can get on there and get help, and there's somebody there waiting for you, and it's a really an amazing time. And you Epic Ladies are definitely a driving force and all that. So anyway,
yeah. I actually think you're going to make our profession much better because it's very much needed.
Kristine, Sarah Jochen just said the Epic Fall Break is going to be in Napa in November. Is that? Yeah, tell us about that.
Yeah, so we were actually sadly supposed to be in Napa here in a few weeks, and I'm sad that we won't be down in that area, but we are doing it in November, and we've kind of split this group up into we have a leadership group, so this one is for doctors, and it's incredible content. We're talking actually a lot about printing and digital dentures, and we'll do smile design, full arch cases, implants. And on top of that, it's the venues, obviously. I mean, James can tell everybody the incredible venues in Napa. So fun. So we're going to be
Napa is gorgeous.
Oh, we're doing like a wine dinner in caves, and we're doing a top chef competition, and so fun. And we had it in Florida last year, and I will say you just kind of walk away just feeling so rejuvenated with all these incredible friendships that you wouldn't have otherwise had, and it's an amazing
Can
opportunity.
Boys go?
So,
can boys?
Absolutely. Come on over. I mean, there's a lot of women there, so if you're not intimidated by that, we're kind of ornery sometimes, but but we have a really good time.
James, let's make an effort. Napa's not too far from you. Let's do it. Let's get on there. Hey, I'm gonna do a self-serving little request for the people that are watching right now. We have 80 hearts right now, and I am not finishing this video until we get to 100, because you know what? This is like
we need 20 more right
20
now.
more.
Come on, hit those love hearts and share love.
There we go. There's three.
There they come.
There they go.
Oh, now there's fireworks.
Oh my gosh!
You got to watch a rerun of this.
This is gonna be great. Thank you guys.
We have such an amazing community.
Hey, Kristine, guess where the love hearts are bursting? They're bursting on my face. I'm also feeling love right now too. I'm watching this, and
as you should.
This is a
loved.
special moment.
Definitely,
this is a special moment today.
Kristine, can we have you on again?
Absolutely. Are you kidding? You guys are amazing. Thank you for including me and asking me to be part of this.
There's something I kind of recognize this just watching your Facebook, but I think we could learn a lot from you in business thinking, particularly with what you've done already in your career. And I look forward to watching you as you excel and lead others into success. And that's my challenge to you. Just develop yourself, which I know you are, and you're a blessing to others. So, and you've been a blessing to me today. So thank you.
Yeah.
Thank you.
Hey, we're at 175. We need to go to 200. I mean, listen, this is kind of a funny thing.
They're coming.
I can't wait to see the hearts go over James's face.
Hey, we've already probably set a record, but it's a pretty high bar. See, Kristine, you're setting our bar today in more than just one thing.
I like it. I'll set the bar hard.
Yeah, Mark Morin, before you, I think you got 3. You only got 3 hearts.
We love you, Mark.
Yeah, we love Mark. No, he's a good guy. Kristine, you're a blessing, and thank you so much for giving us an insight on what you're doing, and not only in your dental world, but your family and your life. And great discussion about the construction. I didn't know that about you. That's really pretty cool. So we will see you on the flip side, Kristine. Thank you so much for coming in. You got any last words for your you got big fans out there. You might as well throw them out there.
I love them all, and I'm just so honored that they're here and supporting and watching, and this is what this group is about. So thank you guys for having me on. It really did mean the world.
Thank you for coming on. The privilege has been ours.
Amen to that. All right, thank you so much, Kristine. James, I think you have like pink streaked across your face. You had so many hearts going across them. They're still coming. I think.
I know they were directed toward Kristine, but I'm getting all the love.
I know. Next time I'm putting myself on that side of the screen so I can get a little love. But anyway,
there you go. Well, that was actually that interview lifted me up because I love to see people who are younger than me that have some skill sets that I didn't naturally have. And what I've noticed in dentistry is when you run your business appropriately, it gives you options. You know, the whole essence of money is having options. And the more options you have financially, the better you can be. And it runs together. And I can tell you, anyone to manage 25 people has to have skill set.
That is
because I had that's the area I had to grow the most in. You know, I have a degree in business, but that was an intellectual degree. It's the heart of business that makes the difference in how you make choices and call a shot.
You know why I need to go to that Napa meeting? Because I need to learn how to be a leader like her. I do not have the skill set to run 10 people. But anyway, she was a blessing and just an amazing time. My friend, you were a great man, and I know tomorrow's a big day for you. Tonight is a big night for me. And you got any last words before I kind of go over our schedule?
Well, I think what we want to do is encourage everyone, and even though there may be concerns and worries right now, stay close with the ones you love. When it's all said and done, and I'm on that final day in my rocking chair, it's going to be the ones I love that I want to be around. And I think that's what we're feeling with our interviews.
Amen. Just a great group. Love the brotherhood and the sisterhood out there as well. Thanks, my friends. And we're going to wrap it up.
Love you guys.
Love you guys too.
Stay safe, stay positive, stay motivated, and we'll see you next time.
Yep. Sunday.
Bye.
Sunday night. See you then. Bye, guys.